One of my favorite things about being a resident here at the UCI Family Medicine Residency Program is the fact that we have great continuity care. So while we're here taking care of patients in our federally qualified health center at our clinic when they're doing well and just here for follow-up, we also get to see them on our own service in the hospital when they're not doing well. And it's a very fulfilling experience to be able to care for them in the good setting, and also maybe when they're not doing so well with their health. I did have that specific experience where I had one of my patients that I had established care with her at the clinic, and we were just taking care of her general health maintenance. And then just a few weeks after, she actually did become acutely ill for another condition, and I got to see her in the hospital and take care of her and get her all well again. So it was definitely a very fulfilling experience, and I really appreciate that continuity of care that we get here at UCI.
I think the best part about the culture at UCI is how tight-knit the community is, not only amongst the residents in the program, but also with the faculty, with the residents as well. The faculty encourages us to hang out outside of the residency program, and it frequently joins at events. And the residents themselves, no matter what class they're in, also have frequently commingle in between the different classes, which I found to be very surprising. Just starting off in residency during orientation, we got to meet our seniors, get to know them better, and see what kind of hobbies and common interests we might have. And I found it to be very, very valuable because everyone knows that intern year is hard, but it doesn't have to be harder than it has to be. And I feel like having a strong community really does make the work and learning that and the growth and development you have in intern year much better, much stronger, and also much healthier as well.
My favorite rotation would have to be on the inpatient service, where we get to meet our patients when they're most vulnerable and sickest. It's oftentimes like these where patients feel the most helpless, and we can do the best we can with the maximal impact with our medical knowledge, with our empathy, really treat them in every way possible, getting to know them such that when they get better, we can follow up with them in our continuity clinic. I recall this family that I met when their father was the sickest, a shell of a man that he was. We stabilized him, and I continued to see him across multiple months during my intern year, and now as a second year, we're talking about possibly getting him a liver transplant. Each time I see him, he's getting better. His sons are there with me at the visits. We're connecting even outside of these visits through the MyChart. And ideally, by third year, hopefully we would have gotten him a new liver, and maybe before I graduate residency, he would be back to his baseline, back to his normal life. I think inpatient service is where we do the bulk of our learning and where we really have that big impact. And so that is definitely my favorite rotation.
My favorite memory from my time at UCI so far, I think, has been when I was on L&D nights, and I had a really fun team with the OB residents as well. And we made a calendar that had us do something every night. So one night was exercise, we did a little exercise video during the night, and then one night we'd get Takeout Tuesday or something like that. And it was the beginning of December as well, and so one of the nights was arts and crafts, and we made little stockings and we hung them up in the room, and it was just super fun and made the rotation so much easier because we were just having such a good time. And it's known to be a difficult rotation because it's on nights and it's hard because you're not with your family medicine residents, but I really enjoyed it. We became really good friends, and we still talk all the time, and we get dinner all the time as well. So it's just really fond memory looking back, and especially with the holiday season, and it was just super cozy, and I just really enjoyed that rotation with the girls.
Even though residency can be hard at times, living in Orange County where the weather's amazing all year round makes up for some of it. You can go out on the weekends and play pickleball. We've got residents who love to go surfing. Dr. Anderson, one of our faculty, has taken residents to sail, and then in the winter, if you want to do your winter sports, Big Bear is only a couple hours away. There's 5 airports within a 50-mile radius of the Santa Ana Clinic. So there's no excuse for any of your friends and family to come visit you and go to Disneyland. So I've loved being a resident here at UCI.
Como un doctor latino, es importante para mí tratar a la población latina también. Y aquí en UCI nuestra población de la clínica es creo que el 90% de latinos, entonces me da mucha satisfacción poder ayudarlos y que ellos se sientan entendidos por mí y cualquier pregunta que ellos tengan yo pueda responderla y se sientan identificados conmigo. Y también para los niños que vienen en el futuro, que me miran a mí como un doctor, que se ve como ellos, pueda que uno de los niños que yo cuido o los hijos de los pacientes que yo cuido me miren a mí como el doctor de la familia de ellos y digan yo también puedo ser como él y puedo ser un doctor también en el futuro. Para mí eso me llena de emoción y es una de las fuerzas que me permite que siga siendo un doctor aquí en Santa Ana y en UCI.